today. Thank you for tuning in to our Facebook live stream. My name is Ivy and I'm a pharmacist from Caring and also a host for today. Have you ever wondered why our skin gets itchy sometimes? So today we have our special guest to talk about this topic. So the special guest is a consultant dermatologist from AY Skin Specialist Clinic. So let's welcome Dr. Adrian Yong Sze Wai. Hi Dr. Adrian, how are you?
Hello, hi. Hi everyone.
Hi doctor, I was actually asking the audience why they get itchy skin sometimes. So since the start of MCO, right, I have seen a lot of issues regarding of itchy skin around the lips and also around the mouth because of frequent usage of the mask and also the hand sanitizer. So is it the same for you as well, doctor, in your practice?
Yes, definitely so. So very recently, in the last 3 months or so, I've seen a lot of patients having a lot of reactions on the face, on the lips, and especially the hands. And for some people, even the feet, because some of my patients are obsessive cleaners, which we all have become since the MCO has started. So mopping the floor many times a day, and with detergents on the ground and stepping onto it, not washing off the soaps properly, will cause irritant eczema to develop.
I see. So I also have seen some customer with dry and also scaly skin. Is that an eczema or is that a sensitive skin?
Okay, so now first thing that we need to understand is the definition of what eczema is. So eczema is basically a description of the skin becoming red, scaly, and itchy. But very commonly, if you have the time now and you're sitting at home, you can have a look at your shins or the front of your legs, and you can actually see some fish scale-like skin known as ichthyosis. So you should be able to see the picture of ichthyosis on the screen now, where it actually tells us that your skin is very prone to drying out. Okay, so who to blame for this is probably your maternal grandfather's side. So you can ask your grandfather now whether he has dry skin too.
Oh, I see. So it's genetic, basically it's genetic issues, right?
That's
so
right.
Any other possible causes of eczema actually?
Okay, so the other thing is with dry skin, besides the genetic condition which I've just mentioned, there are also other conditions such as overwashing, especially in the people who are over the age of 60. They are using soaps which are or detergents which are very harsh, creating a lot of bubbles, and also perhaps using a loofah that's very rough and having a good scrub, because they only feel clean when the skin is extremely squeaky dry, and that is actually very bad for the skin, causing dryness.
I see.
Now, moving on to the groups of eczema. Now, first eczema to be aware of is called atopic eczema, which is genetically predisposed again. So first thing that very common in young kids, when they first develop allergies, they often have very old-looking eyes, a bit wrinkly, a bit rough, and they're rubbing their eyes a lot. Sometimes when they wake up in the morning, the moms will describe their kids as having flu all the time, or having a xiongfeng all the time. So those are actually allergic rhinitis. So it's house dust mite that lives in the beddings, the carpets, and the curtains and all that kind of stuff in their rooms. And the maximal effect is in the morning, because they spend the whole night with all these bugs, with their feces, and then in the morning they are sneezing away. Okay, so that's allergic rhinitis. Now secondly, if allergic rhinitis is ignored, then what happens? There's a lot of phlegm buildup in the nose, and that drips to the back of the throat. So you get patients who have this kind of symptoms like they're kind of clearing their throat all the time. And some family members who are very unkind would just say, stop doing that, bad habit. But actually what they are seeing there is actually post-nasal drip. So the mucus is dropping to the back of their throat, and they are trying to clear their throat. Now if you ignore that again in a young child, they then go on to develop asthma. Okay, asthma. Not eczema, but asthma, where their airway starts getting wheezy, and some of these patients end up going to doctors many times in a month to get the nebulizers to improve their airway. So it's a very preventable thing if you can avoid house dust mite or treat them appropriately with things like antihistamines, nasal drops, nasal sprays, things that your friendly pharmacist can advise you on initially.
Okay, all right. Wow, that's a lot, regarding skin. So doctor, because I know with eczema, right, it's like a cycle. It's like when you itchy, you will scratch, and then itch again, then you will scratch. So all this will slowly lead to infected eczema, right?
Yes, that's right. So the scratch-itch cycle is what we call it. And I can't blame you, because even for myself, when I get a mosquito bite, I find it very pleasurable to scratch. And the more you scratch, the more itchy it gets, the wider it gets. And before you know it, your fingernails can be actually quite fatal. So in a way that I've seen some patients digging their wounds until it's bleeding, it's scabbing. And naturally, secondary infection will set in, because our skin keeps bacteria, fungus, and viruses out, right? But as soon as you scratch or you break your skin, those things can enter the skin and cause secondary infection.
Yeah, because skin is like our organ, our main organ to protect it, right?
Yes, yes,
I
that's
see.
right. Yeah.
Okay, doctor, we have a question from a viewer. So she's asking, is itchy skin related to blood vessels?
Aha, very interesting. Okay, Rosalind, right? So itchy skin, essentially the skin has a few layers. The top layer is known as epidermis, then the deeper layer is known as dermis. Now blood vessels run within the deep vessels, and then you have more superficial blood vessels there. So for example, if you drink alcohol, if you exercise and there's increased blood flow, or you have a hot shower or jacuzzi, which is very hot, it causes the blood vessels to dilate or open up. So you feel that your skin is warmer and perhaps more itchy as well, because there's release of histamine there.
I see.
Okay? So yes, they are related in that way.
Okay, so doctor, with regarding to eczema, right? Is there any way how we can actually treat this problem?
Okay, so to treat eczema, number one, you need to know the underlying cause. So back to what we talked about, if it's ichthyosis, if it's dry skin, good moisturizers, okay? Now what is a good moisturizer? Just briefly, you have lotions, which are mainly water-based, then you have creams, which are slightly more oily, and then you have ointments, which are very, very thick and oily, okay? Unfortunately, I'm unable to recommend any specific brands on air, but those are the different classifications. Now, specific ingredients that you might want to look for include things like bisabolol, which helps to reduce irritation, vitamin E, which can help to moisturize the skin, and of course ceramides, which are the common modern ingredients that can help to rebuild the barrier of the skin.
Yeah, and even vitamin E is good as well, right, doctor?
Yes, that's right.
Vitamin E,
yes.
I see. Okay, so other than moisturizer, what about antihistamine? Will antihistamine be useful in this condition?
Okay, now a lot of people blindly take antihistamines. As long as something itches, they take antihistamines. So one prime example is when someone gets very bad eczema, okay? And eczema, I think you can see the photo of eczema on air now. Essentially, it's red, peeling, scaly skin, and they take antihistamines to start with to reduce the itching. Now that helps to reduce the blood flow slightly to the skin and reduce histamine release. But the skin is still broken, and the skin is still inflamed because of white cells. Okay, particularly white cells, which causes inflammation. So antihistamines has a limited role in terms of eczema control, but it reduces the itching slightly only.
Just reduce the symptoms, basically,
yes,
but it doesn't treat the root cause of the eczema, right?
That's right. So with treatment of eczema, you need to have good moisturizers. You may have to use some topical steroids, and then there's a third line, which is the non-steroid-based products, which is like tacrolimus and pimecrolimus. Okay.
But those have to be under specialist supervision with the pimecrolimus, right?
Yes, that's right.
Yeah. So guys, if you have any questions regarding eczema, do seek expert advice as well, because you can't just simply come to the pharmacy and just ask, I need this specific antihistamine or even steroid cream. So always ask your advice from the healthcare professionals. Yeah. So doctor, we have another question from Malay. Can we prevent itchy skin if we use a better quality face mask? I think this is very, very related to our...
Okay, very good.
Yeah.
Now, I brought a mask as an illustration, right? So these are the surgical disposable masks that you have, and there are two components to it. Elastic band, and then the main body of the mask, okay? So these masks are disposable, single-use masks, theoretically, okay? And what you need to be aware of are chemicals which are used to line these things include formaldehyde and quaternium-15. So if, for example, you have bought a piece of new clothing and you haven't actually washed it in the laundry before wearing it, and you experience terrible outbreak of eczema on the skin, then you are probably allergic to formaldehyde, because that's the substance that's used to make clothes anti-wrinkle. The other thing is some high street brands of detergents or soaps may also contain formaldehyde, albeit in very low concentrations. So that may cause problems. Why? Because when you wear the mask and you're breathing through it, there's a lot of moisture trapping, and it actually leaches the chemical out. And when it gets in contact with your skin, it can produce an allergic contact eczema.
Yeah.
This doesn't happen immediately. It tends to happen within 1 or 2 days later. Okay. Now the second component is elastic. Now, elastic contains rubber, and the joining part contains adhesives. So if you're allergic to plasters, you're going to get 4 points of allergy. If you have elastic band or rubber allergy, your ears are going to start getting irritated and itchy as well.
Yeah, okay. Yeah, I actually encountered this also with customer complaining about like broken skin behind the ear.
Yes.
Yeah, really a lot of issues.
Yeah. So those are the non-fabric masks. Okay. Now we moved on to the fabric mask.
Yeah,
fabric mask is in the form of cloth mask. Okay, and the best material to get is obviously cotton-based. However, there are a few things again. So if the dye or textile dye that's used to make the cotton-based mask a certain color, and if you're very allergic to it, that may cause problems as well. Okay. The other thing is some people who use detergents to wash them will leave some residues of fragrance.
Okay.
And if you're allergic to things like perfumes and essential oils, that will cause a major issue with outbreak there. So it's not another allergy to, say, cotton, but it's all the chemicals which are used to process the fabric masks. So one has to be careful.
So actually, the main thing is still have to find out what are the allergens, like what causes it, and try to avoid the triggering factors, right, doctor?
Yes, that's right.
Okay. So doctor, we have one more question from Mei Wong. So she said her daughter has itchy skin on her fingers, and she has tried Betnovate. I know Betnovate is a very strong steroid, right? And she said that it's still not working.
Okay, so Mimi, now I think the first thing to say is that we need to look at the pattern of itching and also whether there's any breakage in the skin. Okay, so what's common for itchy, sort of literally itchy fingers, is when because young kids they like to play with slime, they like to play with various things, and they touch. Curious ones will touch a lot of things, and that may leave residues that causes irritation. For example, in this time we're using a lot of alcohol-based sanitizers. That can cause irritation. Okay, and then of course kids will not stop scratching and they won't tell you, they'll just scratch it, right? So what you need to do is to actually get rid of all these potential irritants first. Secondly, to moisturize regularly. Okay, now Betnovate is a steroid that's used to put out the fire when the eczema is there.
Yeah.
But it's only if it's truly eczema rather than just irritant dermatitis. Because in the long run, if you are using tubes and tubes of Betnovate, can actually cause skin thinning, yes, and irritation there. And so the barrier is actually more destroyed than what it would be before if you're using it inappropriately. So the priority here is to diagnose what the underlying cause.
Yeah.
Okay.
So first to get a diagnosis first, instead of just going to the pharmacy and looking for the specific brand of like steroid cream, right?
Yes,
yeah, because this is what I have been advising my customer as well, to just use thinly and use it for like short term. Yeah, it's important. Okay. So guys, don't forget, because we have a giveaway contest, so don't forget to answer the question. The question is, can antihistamine treat itchiness? Just answer yes or no. And remember to hashtag Caring Pharmacy and Benarini, and together tag 3 of your friends to increase the chances of winning. Okay, doctor, we have next question. So does people with eczema, with asthma has eczema? I think I'll touch on this right just now.
Yes, so we mentioned the atopic march earlier. Basically, allergic rhinitis, atopic eczema, and asthma. So this is called the triad, or 3 conditions which are very closely related. And very often people who have aeroallergen allergy, for example, house dust mites, cat dander, for example, or pollen, may then develop initially no symptoms, and then they develop asthma after that. So yes, you're absolutely right, Sindhu.
Okay, so doctor, I also have seen some customers, right? They have like itchy bumps. I think it's known as hives, so also known as urticaria. So doctor, can you explain more how this happen actually?
Okay, so that's a very good question. Now, I think we have to differentiate between what eczema is and what urticaria is. So coming up now, you can look at a photo of what urticaria is on screen. And urticaria is basically swelling of the skin, which is deep, which is within the dermis, okay? So we mentioned earlier epidermis on the top, dermis in a deeper layer. So swelling within the dermis due to histamine release. Now this might feel as burning, itching, tingling, and you may even feel the symptoms before the bumps actually appear. And they can be as small as almost pimple-like pinpoint areas. For example, with cholinergic urticaria, where increased body temperature releases this histamine.
I see.
Or it may be true-blown sort of prawn allergy or seafood allergy, which causes big patches all over.
I see.
And some people have even swollen eyelids, they can't open their eyes, or swollen lips and tongue. So all those are urticaria and angioedema. Okay. Now, in that position, the first priority is to find out the underlying cause again. Okay. But of course, in the immediate term, you would want to take an antihistamine to try and control the symptoms. Now, if you're taking regular antihistamines, meaning the licensed dose of at least once a day, and you start to feel that after 2 or 3 days, it is kind of less itchy, but it's still appearing, then you ought to see a doctor or specialist to get the diagnosis.
I see. So doctor, can a person take antihistamine for a lifetime? Would there be any issues with taking antihistamine for a lifetime?
Okay, so I think question of whether to take antihistamines long term, it is safe provided that you have seen a doctor and a diagnosis has been made.
Yeah.
Okay, not that the antihistamines causes harm, but the harm comes from a misdiagnosis, meaning that an underlying serious condition is not discovered until very much later.
Yeah.
So that's where the main danger lies.
Sure. Okay. Okay, we have more questions. Okay, another question is about supplement. Can young kids take supplement for itchy skin?
Okay, so in terms of supplements, I think Ivy would be able to advise more on the pharmacy side of things.
Yeah.
Okay, so any comments on that?
For young kids, actually, you can try something like omega-3 because omega-3 is rich fish oil. Fish oil because rich in EPA and DHA, and these are good for inflammation. So maybe kids can start taking fish oil that is good for the skin. Okay. So the next question is, so this lady is having rashes whenever she has fever. So it does give me itchy feeling. So is it to do with immunity then?
Yes, okay.
Yeah,
so Vinuti Supia, right? Okay, thank you. Sorry if I got your name wrong. But essentially what hives are, now Urticaria in itself is about a 1 hour to 1.5 hour lecture, okay? But I'm going to try and break it down as easily as possible. So you have two types, acute urticaria lasting less than 6 weeks and chronic urticaria lasting longer than 6 weeks, okay? Now, some people have a lower threshold for hive or urticaria occurrence, and that's from either mast cells or your basophils releasing histamine. Okay, now so that's the first thing to understand. Second thing is when you have a fever, it's very likely that you have an infection on board. Now, the release of histamine from our immune cells serves to protect us. For example, when a mosquito bites us, we want to get rid of it, so it creates itching and swelling, so you know that there's a problem there. It's like your house alarm or burglar system to tell you you need to get the invaders away.
Yeah.
So when you have a fever, the same thing happens. Your immune system is trying to tell you something. That's why your temperature goes up, you feel unwell, it makes you rest, right?
I see.
So, and the same thing is hives can come up at that time. So of course, taking Panadol or paracetamol to settle down the fever, taking antihistamines to stop the itching and the hives are very good things to help make you feel better. But again, if the condition lasts much longer than a few days, then there might be something serious underlying it. Okay. Now, your question specifically about whether it's to do with the immune system, definitely, because I've just mentioned the two cell types, mast cell and basophils, which are both very closely integrated with the immune system. That causes that sort of reaction.
I see. Okay. So, doctor, what about heat rash? So, how do we treat heat rash?
Okay. Heat rash, first thing, avoidance. So if you can avoid the heat in the first place, it's good. You can bring a cool water spray with you. And also maybe a cool towel to cool down or a portable fan. That's the first thing. The second thing is as soon as it happens, you might want to put something that is quite cool on the surface. So menthol based or a cream that's already put in the fridge and you bring with you. So then you can cool it down if it's a recurrent problem. Then finally, of course, antihistamines can help too in a mild way, basically for the itching. But it doesn't stop it from happening in the first place.
I see. Okay, so we have a next question from Jerry Liu. Does probiotics help on allergies condition? So maybe I will answer on this question, doctor. Okay.
Yeah, so I think there's a lot of controversy around probiotics and atopic eczema. But if you were to ask me as a specialist, I'll refer back to the Cochrane review, COCHRANE review. This is a sort of group of meta-analysis where they group all the populational studies together to see whether there's a signal, okay, maybe 10 or 15 studies, to see whether probiotics actually helps to improve atopic eczema. Unfortunately, the answer is no. So I think anecdotally, a few people may say that it does help, but we know that atopic eczema or eczema has ups and downs. So it might be that they're taking it at a point where it's already improving and they attribute it to improvement of eczema. But clinical studies at this moment shows that it's not beneficial scientifically.
Yeah, okay. So the next question is on Miss Chan Pek Yin. I found that I have skin allergy after I give birth to a third baby. Is that due to hormone changes? So skin allergy is mainly around her knee area. Okay. Hormones.
All right. So I think the first few things is to consider your nutritional status, especially if you're breastfeeding and if you have developed a little bit of iron deficiency, that can create a bit of itching, a bit of skin sensitivity and dryness. Okay. Now, since you mentioned that it's on your knees, that's particularly more likely that there's an irritant component. So you have to think about, is it a position that you put your child on, or is it some regular thing that you put on or exercise on, or there's some sort of friction causing local irritation? Because if it's a hormonal thing, the skin will start flaring up almost everywhere from head to toe. It's not just going to be on the knee area.
I see. Okay. The next question is on, I will start to scratch my skin whenever there's exposure of sunlight. So is the sunlight cause sensitive skin?
Okay, very good question. Now, sunlight is good and bad in a way, okay? So one component of sunlight, of course, is infrared and it causes heat. So if you have a predisposing condition like rosacea, okay? Rosacea is a condition when you take spicy foods, when you have sun exposure, or when you're hot or angry, your face starts to flush red and it's kind of like burning sensation, it's itching, it's very uncomfortable. So that may be triggered by sunlight too. Now, second thing, it might be the heat itself. So if you feel that heat itself without sunlight produces itching, for example, when you have a hot shower, then that may be a physical trigger. So it might be a pressure related, it might be temperature related that causes urticaria or hive release. And that in itself can cause itching.
Okay. So the next question will be, after she has taken steroid, will the skin become worse?
Okay, so question by Sharon, right?
Sharon,
so now when you refer to taking steroid, I presume this is oral prednisolone or an equivalent, okay, an oral steroid. Now, the main point of steroid-based tablets or treatments is a little bit like a fire extinguisher, okay? So I think the question of, does fire extinguisher make a fire worse? I think you have the answer there, okay? But does fire extinguisher make a mess if you use too much of it on a fire? Yes, as well. So you have to use it appropriately and correctly. And for different types of fire too, whether it's an oil fire or gas fire. I think you have to understand that fire extinguishers are definitely necessary for a fire, but it's how you use it that will keep it safe for the general public like yourself.
Yeah, so basically just make sure that you are taking the steroid correctly, and how you apply steroid is also in the correct way. Okay, so the next question is by Honey Chan. Will someone outgrow their allergy?
Okay, so it is said in a lot of studies that atopic eczema, for a lot of kids, they tend to outgrow their so-called allergies at the age of 5 or 7, about 1/3 or so. Another 1/3 or so, maybe 15 or 16, and so on. But in reality, I mean, in my clinic, it's because they haven't outgrown them, and they've been told by a lot of parties that they will outgrow them, which is why they are very concerned. So I think because eczema is such a multi-modality and allergy is the same as well, okay, there are so many factors. One is genetics only, but how about skin barrier? If you're not looking after your skin barrier properly, it's drying out, and you are, for example, living in a country where there's low humidity, like the UK or the US, naturally your eczema will may become worse because of the dryness, okay? And in terms of allergy, we know that contact allergies get worse. For example, if you're young and you have played around with a cheap nickel earring and you just wear it, it might take a month, 6 weeks to develop a bit of redness. But as you get older, even things that are very, very low in nickel, you can wear it for a few hours and it may start to itch already. So contact allergy actually gets worse with age.
I see.
Okay. Now, food allergies like peanut allergy tends to stay with someone lifelong. Okay. Certain other kinds of allergy like house dust mite allergy may improve with time. So, but there's no definitive way of defining these population. The best way is to limit exposure when you get the symptoms, because your body is trying to tell you something.
Yeah.
Okay.
So, doctor, do you suggest then for them to go for an allergy testing?
Okay.
To
now,
find out.
allergy testing is appropriate based on the correct history. Okay. If everyone was to go for allergy testing, it will be very cost ineffective. Okay. So, of course, it's nice to have every possible test under the sun, but I think it's more important to find out what is the story. So the typical story is someone who is maybe 1.5 years, 2 years, keep getting rashes, eczema, use of potent steroids, been in and out of hospital, and they can't control it. Yes, blood tests will tell you, because cow's milk allergy, maybe other food types of allergy, even soy milk and house dust mite may be at play. And when you start avoiding those allergens, they get much better and they stay out of hospital. Okay. Now another type, someone who tells me that they go when they have a warm shower, the hives come up, always when they're just walking randomly, it comes up. I think in that situation, it's more likely to be a physical trigger. So if you have the funds to test them, then it's appropriate, but I wouldn't recommend it as such.
Okay. So another question from Angel Key. There are many types of antihistamine, but some outgrow the effectiveness of an antihistamine.
Okay, Angel. Good question. I think this cause and effect thing is obviously it's always discussed. So one of the things that I would like to draw a parallel to is the steroid withdrawal syndrome. Okay, a lot of people call steroid withdrawal syndrome the fact that they have severe eczema, they keep using steroids and getting stronger and stronger. And despite using them, they still get worse as soon as they stop the steroids. Now, what is the problem here? The problem here is that if you have a fire that is spreading, okay, but you're using a fire extinguisher that is of larger and larger volume, but you're not stopping the source of the fire. So there's a fire starter on the other side.
Yes, it keeps spreading.
Yes, so you're never going to stop. And the thing is, you can't say that your fire extinguisher, you're getting used to the fire extinguisher, because it works. But it's just that the fire starter is starting new fires and making the area larger. So if you're feeling that the antihistamines are no longer working, it means not that antihistamine is not effective or that you are getting resistance to it. You have to ask yourself, what is the lifestyle? What is the dietary source? What else is happening that is making your antihistamine less and less effective, but actually more and more allergen triggers that you need to identify.
I see. So we're changing to other types of antihistamine be helpful actually?
Okay. Yeah, so if you were to use the older generation antihistamines, it may cause a little bit of drowsiness. So the shorter term antihistamines which are drowsy are not recommended.
Okay? Drowsy are not recommended.
Yes. So the newer generation ones, the non-sedating ones, I can't mention specific names, but it is very independent in the sense that there are some people who will tolerate certain antihistamines more than others.
I see.
Okay? But of course, it's my role to also tell you, for those people who are more discerning, you can look at specific studies for certain antihistamines, which actually test them in pilots, okay? Because pilots cannot be drowsy when they're taking antihistamines. And imagine if they have urticaria.
Oh,
okay?
no, that's,
so that's one category. The second category are F1 drivers, okay, those high performance vehicles. And of course, they can't be drowsy as well. So I think these few things you can consider. If they're good enough for pilots and F1 drivers, they're probably good enough for you.
Okay. All right. We have the next question from Connie. So her grandma developed dye rash after she started wearing adult diaper. Is that considered as eczema?
Okay. So eczema is defined as redness, scaling, peeling, inflamed skin. So yes, but this category of eczema is called irritant. So it's the same as putting detergents or hand sanitizer on your hand, leaving it on, then it will cause irritation. So that's called irritant eczema. Yeah. So eczema is just a description. It's just a bit like saying my skin is itching or dry skin. Yeah. But what is the cause? Yeah.
Because there are so many types of eczema, right?
Correct.
Okay. So the next question from Tiomi, is there any effect if you use long-term of corticosteroid medication for the skin?
Yep. Very good question, Mi. So long-term use of steroids has to be defined very clearly. Okay. Now, if you're using the super potent, okay, meaning clobetasol range, okay, then it shouldn't be used longer than 1 to 2 weeks in a row, continuously every day. If you're using something that is on a weaker range, okay, like hydrocortisone equivalent, then you might be using it for 30 days in a month, and it's still not helping your eczema. Okay, so the key question here is what is suitable for your skin inflammation and what is the underlying cause? There is a very common misconception that if you have very severe eczema and 1% hydrocortisone doesn't work, it means that I'm in trouble and my eczema is not curable, which is a very, very big myth. Because what it means is that you need to identify your allergens, number one. Number two, stop the irritants. Number three, repair your barrier with a good moisturizer. And fourthly, tame your immune system. So we need to find out what non-steroid-based immune system modulators can be used to tame them so that you can get back to your normal life. Okay, no one should be living with very, very bad eczema that they can't go to school, that they're embarrassed because they're shedding so much skin. that is bleeding and itching all night long.
Yeah,
Okay?
because I do understand the frustration I see in my practice. Like customer always complain to me saying they can't sleep at night because of itchy skin. So I think it's still back to the basic, using a good moisturizer, find out the triggering factors like what causes eczema, and also maybe have a healthy lifestyle with a good diet. All this can help to control the symptoms. Because eczema, I think if you control it well, it doesn't flare up, then it will be good, right? Okay. So another question from Yusuf. Why does my skin itch at night only? Yeah, I think this is a very common question that I see from my customer. So he said he only feels very itchy at night, usually itchy at his hands and also legs.
Okay, so there are 3 points there with the itching at night. The most famous condition that itches terribly at night, that you can't sleep at all, is scabies. Now, scabies are mites which attacks between your fingers, between your toes, and maybe in the groin area. Okay, but now that you mentioned palms and soles, it might be related to internal disorders like the liver. So a liver function test would be appropriate because that's the first area that you would start to feel itching. Now, of course, if you consume alcohol at night, that will make the itch even worse.
I see, alcohol.
Now, the other hypothesis in a way is by if during the daytime you're busy, your mind is busy, and cortisol or stress levels are up, it actually protects you against these sensations of itch. But as soon as your mind quietens down, the room is dark, and you're trying to relax your mind and go off to sleep, you start to notice smaller things. Your ears might be ringing, your hands and feet will start to itch. And interestingly, this is also the same concept where people who are in their sunset years, where they've just retired, suddenly develops a lot of odd symptoms because they have come from a very, a highly strung job, perhaps corporate world, that everything is rushing around, and then suddenly they've retired and they have nothing to do and they're sitting at home, and suddenly they get all these symptoms. So I think this is important to, to be aware of, that we have to keep our minds and our body busy.
Okay. So the next question is from Chai Kit. He always feels itchy after using detergent or dishwashing liquid. So how can this be improved besides using hand gloves?
Yes, okay, Chai Kit. Now, your symptoms are typical for irritant eczema, which means it's dry. So you need a very good moisturizer, basically either a cream or an ointment, something thick enough to provide a barrier. And I know what you're going to say, it's too oily when you're touching things and all that. So the best way is to actually put ointment on and then put cotton gloves on at night to trap in the moisture so that during the daytime, even if there's some irritation, at least it locks in the moisture.
Okay. All right. So the next question from Afifa. Can allergic contact dermatitis be prevented with usage of frequent emollient rather than usual soap? So basically this is the question.
Okay.
Frequent emollient.
Yeah, so the point here, Afifa, is the allergic contact dermatitis you're talking about is basically allergy to chemical ingredients. Okay, we're talking about parabens, methyl isothioxanone, maybe fragrances in soap. Okay, but these may also be present in certain emollients, for example, creams, lotions. Okay, so the only safe sort of emollient, so to speak, in a way that has no additives at all, is an oil-based ointment. But most of us do not have to go as far as that. I think if it's allergic contact dermatitis, you would probably need a patch test to identify what you're allergic to. And then once you know the chemical ingredients that you can't use, you can get on with life. You don't have to fear changing from one brand to another, changing one preparation to another, and so on.
Yeah, so it's important to trial and error on different brand of the moisturizer and emollient, right?
No, that's not what I meant. So what I meant was using a patch test to identify what chemical ingredients you're allergic to. And then using that, you can decide which moisturizers you can pick up from the pharmacy, rather than picking and choosing. Yes, because otherwise you have 10 or 15 brands, because some of the brands may also be produced in a similar fashion with the same ingredients. So you end up wasting a lot of money after use or for 1 or 2 weeks, and then you have to change again.
That's true, because it's also quite costly, right? Getting all the different moisturizer.
Yes,
yeah, because with different moisturizer, they have contain different ingredients. So it's to find out, to read at the ingredients, or maybe you can ask the advice from a pharmacist who can help you to find out what ingredients that's suitable for your skin. Okay, so I have a next question regarding supplements. Okay, so does vitamin E, A, or D recommend as daily supplement for eczema sufferers? If yes, what is the recommended dosage?
Okay, so these are circumstances where you're vitamin deficient. and then it would help. So for example, we talk about vitamin D first, okay? Now vitamin D deficiency can cause a lot of symptoms. Grumpiness, dry skin, irritability, a lot of non-specific things. So vitamin D mainly is used for bone strength and muscle strength. So those things that if you are vitamin D deficient, then you'll be advised to supplement them, especially as you get above the age of 60. But the main indication for that is not really the skin. It's mainly for bones and to prevent osteoporosis and fractures.
Yes, vitamin D.
Okay, so that's one. Now, vitamin E can be helpful in allowing better moisturization on the skin surface. But one has to be careful because oral vitamin E, okay, E for echo, has been associated with allergies as well, where they start developing, sort of skin reactions to that. So it's not all good, you have to be careful. Okay, so try a small amount first and see how that goes, okay? Now, vitamin A is commonly used by dermatologists to treat things like acne, okay? And also sebaceous hyperactivity, basically when there's a lot of oil secretion.
Yeah.
So if you're taking too much vitamin A and you are planning to conceive a baby, to become pregnant, there is a risk there because it can cause birth defects.
Yeah.
So it's not really advisable to self-medicate at very high doses in that way.
Vitamin
But,
A.
Yeah, but the over-the-counter supplements in general will do very little harm in most cases. Okay, but only if you start to have specific deficiencies which we can measure either with blood or after clinical examination, would we recommend those supplements rather than just blindly supplementing.
Yeah. Okay. So the next question, I think, is regarding pimples. So he said there's some white, I think this is acne, so there's some whiteheads coming out behind the arms. So what is the cause and how you can deal with these pimples?
Okay, so acne or pimples can affect the face, armpits, groin, back, chest. Okay, those are the commonest sites. But it never affects the palms and soles. Why? Because there's no sebaceous gland there. Sebaceous gland is the gland that produces oil that actually provides another layer to trap heat and also to protect the moisture levels on our skin. Okay, so the role here is that when there's sebaceous hyperactivity, which means it releases too much oil, it starts to produce pimples. And the first kind of sign is black and white heads when the pores are blocked. Secondly, it becomes inflamed and swollen, and you might form pus. Okay. Then the last stage is where the cystic acne, very, very deep acne, which then bursts and it forms inflammatory holes where there's ice pick scarring and all that.
Oh, so this can lead to scarring in the future.
Yes, correct. So the main root cause of the problem is the sebaceous gland. Now, what feeds into the sebaceous gland? Number one, genetics. So if you see your parents have, sort of a moon crater surface on the face, it's very likely that they had very bad acne when they were younger. So that's one risk factor. Secondly, food. So what food types have been associated with severe acne and sebaceous hyperactivity? Chocolates, fried foods, high carbohydrate diet, okay, irregular sleep patterns, okay, and smoking as well. Okay, so those things can add to the hyperactivity. Yeah? And then of course on the outside of the skin, if you're using things which clogs up the pores, you're using creams which might be too moisturizing.
Or even makeup.
Yeah, or makeup. Yeah, those things will cause that.
Yeah.
And then of course commonly we see hair-related issues as well, where the hair is covering the forehead and a lot of acne is hiding under there. Okay, so in your situation, I think the back of the hands most likely is exercise-related, heat-related, or maybe they're sitting against a chair which is trapping the sweat and it's not allowing the skin to breathe. And that's why the acne keeps coming back.
I see.
Okay.
Okay, so another question which is regarding hand sanitizer, frequent usage of hand sanitizer causing the sensitive skin. So is it because of the alcohol in the sanitizer causing it?
Yes. So Angel, that is a very common problem now, and you can't really prevent that because I think this is the standard operating procedure everywhere now. I think the only solution to this problem with younger kids is restoring the skin barrier as much as you can overnight. Because you have 8 hours, 9 hours of sleep, that's when you have the chance to put cotton gloves on and moisturize the skin.
Yeah.
Okay? But during the daytime, you can't really tell them not to use alcohol sanitizers or they will be in trouble too.
Yeah. Maybe another advice is after using the alcohol sanitizer, you can just put on some moisturizer after that. So basically it's a frequent usage of moisturizer to keep the skin moist, so to reduce these issues. Okay. So another question is from Honey Chan. Is there anything that she can start since young or parents to prevent kids from developing maybe developing problems like itchy skin like this?
Okay, so honey, if you come from a family of genetically predisposed eczema, meaning that there's a lot of dry skin in the family, the best thing you can do is just moisturizing regularly, using less harsh or bubbly soaps, and that will be the main thing to prevent. Now, the next thing is, of course, if the skin is broken, like there's an injury or where there's mosquito bites, then you should get on it quickly so that the itching or itch-scratch cycle doesn't start.
Yeah,
so those are the main
cycle.
Yeah, so you have to be proactive. But in terms of supplements, there's no evidence, very strong evidence to say that if you were to take a certain supplement that it would definitely stop them from developing eczema.
Okay. So another question from Malai. What about essential oil for itching?
Okay.
Is it advisable?
Yeah, so essential oils are predominantly composing fragrances. So if your itchy skin is due to broken eczema skin, then what's happening is you're sensitizing your skin or your immune system to fragrances, which means that you might develop fragrance allergy in the future.
I see.
However, if it's just itchy skin due to hives, there's probably no harm because the epidermis is not broken and it's just histamine release internally. And then, of course, there are certain categories of people who are already allergic to fragrances. So I wouldn't recommend essential oils as a blanket soother for itchy skin. Depends on what the diagnosis is.
Okay. So another question from Noor Mustafa. How to choose a better product for skin to avoid allergies?
Okay, now this is a very big question. It's a bit like, which car should I buy for my family? Because it depends on your needs, all right? So if it's someone without any severe eczema and it's just mild dry skin, you can probably get away with lotion because you want a consistent application where the child can take it and they don't feel irritated. Now, if you were to come to me and you say, oh, my kid's skin is always broken, it's always dry, when I put lotions on, it disappears, you know, there's no moisture at all after 5 minutes or 10 minutes, then you need to upgrade to something thicker, like an ointment.
More oily, it will be more oily type.
Yes, correct. So there's no one size fits all, which is why when you go to a pharmacy, you have like shelves load of different brands, different mix. And, you know, the nicest thing that we would all want to get to is to have sample size items of each brand there. But it's not possible because of the cost and also shelf space. But this is ideally how we can do it so that you know whether the cream suits your, to your liking, to your smell, to your skin type, and whether it causes local irritation.
I see.
Yeah.
Okay, Doctor, I think that's the end for our sharing session today. Thank you so much for your time to talk about to us about itchy skin, like what are the solutions. So, Doctor, do you have any final advice to give to our audiences over here today? Okay,
so I think the main thing is knowing a lot will instill a lot of fear. That's why doctors have a lot of things that you will feel as general public that we seem to be scaring you because we know a lot and we've seen the severe cases. On the other hand, not knowing anything, it's actually safer than knowing a little. Because I've seen patients who have known a little by picking up a few points here and there through common talks like this, and then they self-medicate and end up in trouble.
Yeah.
So I think the general guideline to managing your skin safely, number one, first line would be to seek a pharmacist review in any pharmacies, and that's the first line medication maybe for 2 or 3 days. And if things recur, meaning after that medication use it happens again within 7 days, 10 days, then I think some warning signals will come back and you probably need to seek someone more experienced with dealing specifically with the problem. Okay?
Okay. Okay, so guys, don't forget about the giveaway contest. So just answer the question, can antihistamine help to manage itchiness? And just answer yes or no. And hashtag Caring Pharmacy Menarini. And then remember to like, share, and tag 3 of your friends to increase the chances of winning. Okay, Doctor, so thanks for today. I think I've learned a lot regarding the causes of eczema, like what are the symptoms and how to treat. And I believe you guys have learned a lot as well. Thank you. And remember to like our Caring Facebook page, share it to all of your friends. Thank you so much for today. Thank you. Bye-bye.
Okay, bye.
Bye.